Thank you very much, Mr. Chair, Dr. Casey, distinguished members of our board. Excuse me. It is a pleasure to be here today before you. Just wanted to provide you an update on the police department in 2020, kind of a year in review of police operations in a memorably challenging year, but some good news. So just to recap, I know we all witnessed it firsthand, but 2020 brought about a bunch of unique challenges to our society and therefore to our police operations. Obviously, we have been dealing with the COVID-19 pandemic, nationwide civil unrest, political turmoil, pretty unprecedented political turmoil. We've dealt with anti-government groups on both extremes of the political spectrum. We had a 700-year flood exclusive just to Chesterfield County, you know, as if the rest of the year wasn't challenging enough. A complete revamping of the workplace, supply chain management challenges. You'll notice the graphic of the roll of toilet paper up there. Whoever knew that we would ever be challenged in that particular type of context. Unprecedented spikes in overdoses, and obviously fear and uncertainty gripping the community. And of course, what do we do as the police department? We're here to address concerns of fear and uncertainty. So a very challenging year, and in April, during a quarterly video presentation I provided to our staff, I actually identified that, hey, we're gonna have a challenging year. And what I said to our staff was this: good organizations survive difficult times, great organizations flourish during difficult times. And I think that as I go through this process of highlighting the year and the accomplishments of our agency, you will draw your own conclusion as to how to distinguish our organization. So moving forward, our Operational Support Bureau, we're divided into 4 bureaus, so I'm going to break this down based on those bureaus, and I'm just going to highlight some of the key accomplishments of those bureaus. So from a community services standpoint, I'm very proud of this one. Again, unprecedentedly difficult year. We've been participating in National Night Out for years, and many of you participated in it. I know Dr. Casey was in the van with me during National Night Out. We placed 4th in the United States among agencies that serve a population of 300,000 or more. That is our highest rating ever as a police department, and that's an extraordinary accomplishment. We modified our Citizens Academy. We held 4 Citizens Academies, 1 Teen Academy, and a legislative information session, which was new and I think remarkable because it really helped inform and enlighten some of our lawmakers who are developing policies during challenging times. I should also add that we conducted a series of community forums that Mr. Holland was instrumental in orchestrating, and without exception, every person who participated in those community forums left those forums with a deep sense of understanding of our purpose and a sense of efficacy for the work that we do. Animal services, we emptied the shelter in December. That is a rarity for government animal shelters. All adoptable pets were adopted by Christmas. We were actually, our department was featured in People magazine in December. We returned 728 pets to their families. If you have a pet, you love your pet, you understand what a huge contribution that is to our community. 728 little fur babies returned back to their homes. We achieved an 86% save rate in our animal shelter. For those of you who don't know, a 90% save rate is considered a no-kill shelter. For a governmental organization, that is a remarkable save rate. So kudos to our animal control folks. Emergency management, we developed a robust department-wide plan to mitigate risk in a COVID environment. We'll get into that in a little bit more detail in the future. We successfully worked with public safety partners to respond to community needs in the midst of the impromptu 700-year flood, which there were a number of evacuations that had to take place. And I think that really solidified the ongoing cooperative relationship we have with our public safety partners, media and communications, finance, everybody in the county coming together during remarkable circumstances. So we really celebrate that. Speaking of celebrating, we finalized an MOU between CCPS and the police department. And for that, I just want to take an opportunity to thank Dr. Doherty for his work on that, legal, everybody who got involved in that MOU. That was a big accomplishment. It was years in the making, and we got it done last year. Our child safety personnel created online content, obviously pivoting to a virtual environment. Our commitment to helping children and keeping them safe doesn't stop just because in-person school has stopped. Our police service aid program, this is one that I'm particularly proud of. Many of you may know I started my career as a police service aide in a suburb of Fort Lauderdale. We implemented the program in 2020, and we created what I call the school-to-squad pipeline. In other words, I want a mechanism that we can employ our school children as they graduate from school and bring them into a career in public safety in Chesterfield and recruit from our hometown, so that our police department reflects the diversity of our community, and so that the kids in our community have a pathway to success, and we keep talent local. And I think that's important, and I think it's valuable. So we implemented the program in 2020. Our police service aides respond to an average of 150 calls a week. We're taking those calls off the hands of our sworn personnel, and they're allowing our sworn personnel to conduct investigations, get involved in proactive traffic enforcement, for example. That's our #1 complaint, right? People are speeding up and down my street. Well, we're able to free up officers because of our police service aides. And this is one of the things that I'm most proud of. Of our 16 police service aides, 6 of them have been hired to go into our March Academy, the 81st Basic Recruit Academy, and what we're seeing is that pipeline. Another thing that I think is really wonderful about that is of the 6 candidates who are going into our police academy, the majority of them are females or minorities. So the ability to recruit from our community is taking place, and that is part of the vision of the program, and it's working out well. We know their work ethic. We know that they're remarkable. They're set up for success, and we're excited about that. So we also implemented an unmanned aerial systems program. That was 18 months of planning and progress, but it has really increased our capacity for search and rescue, for officer safety, and that's something we're very proud of. You probably recognize Rudy and Maisie, our 2 bloodhounds. The community loves them. The department loves them. Ms. Haley, I know you're also a big Pittsburgh Steelers fan, and Rocky Blyer actually responded to one of our tweets about Rudy. A graduate of Notre Dame. We said Rudy was the run of the litter, and Rocky Blyer said, so was I, and it worked out well for me. So really, really happy about that. But our Bloodhound program is something that we're really proud of. We acquired 2 bloodhounds. They were donated by a breeder, and so it was of no cost whatsoever to our organization. And that really increases our capacity to effectively search for missing people, endangered people, older folks with dementia, people suffering from mental illness who have gone missing. So our Bloodhound program really is an enhancement to one of our key goals, which is the protection of the vulnerable. They're also really cute, and they're very popular on social media. The district station enhancements, we upgraded our Swift Creek station on Hall Street to facilitate the new deployment of our staff in our UOB. So we're really pleased about that. We doubled the square footage in order to facilitate that. Uniform Operations Bureau, those are not stock photos, by the way. Those are our personnel in the city of Richmond during some of that civil unrest. Those fires are real. Those personnel are real. And they really responded, I think, nobly and admirably. We provided operational support for the first 4 days of the civil unrest in Richmond. Former Chief Will Smith called me the second day of the civil unrest and actually said, quote, Chesterfield PD saved our bacon when they showed up last night because their personnel had been cornered by a violent mob, and we were able to intervene and help them. I'm remarkably impressed with our SRU folks and their commitment, as well as their families. That's a very unsettling experience when your loved one is out of town or out of the county and facing that type of violence. And believe me when I tell you, there was a tremendous amount of violence going on. Our personnel performed honorably and valiantly in the face of adversity at great personal risk, and that is something that should be recognized. DUI enforcement, once again, we upped our DUI enforcement. We made 1,116 DUI arrests in 2020. We continue to be committed to traffic safety. Regardless of our efforts, we lost 35 people on our roadways last year in Chesterfield County. 35 people. We lost 67 people to drug overdoses last year. These are all preventable, and they're all things that we are committed to continue working toward, whether it's through narcotics enforcement or traffic enforcement. We cannot have people randomly dying in our community. So that's some of the roles that we play in there. Personnel division, we, for the first time in 25 years, on July 13th, we hit our sworn strength, our sworn capacity, and we continue to grow. We're doing a really good job as far as recruiting is concerned. We've been able to attract and hire experienced personnel from surrounding agencies in the region while not losing any of our personnel to those agencies. I think that says an awful lot about our culture. I think it says an awful lot about the organization as a whole, not just the police department, but the county in general. We transitioned to the use of assessment centers for professional competency evaluation. That is an industry standard for assessing supervision and leadership, and so I'm very proud of that. We instituted a Guardian EDP system, and basically what that does is that gives us the ability to provide near real-time feedback to our personnel, good and bad, coaching, documentation. There's nobody at the end of the year that gets their evaluation that says, well, this is a surprise, because every counseling, every coaching, every attaboy, accolade, it's all documented, and when it is documented, the employee gets a copy of it immediately via their email. So everything is open, everything is transparent, as it should be. We became the first police department in Virginia to produce a podcast, which is available on Apple Podcasts, Spotify, and YouTube. That was a shameless plug for it, but go there and download our podcast, learn more about our police department. HR Manager Lisa Scott was awarded our Civilian Employee of the Year, and Captain Mike Young was awarded the Chief's Commendation for his leadership of the division. They have really done a remarkable job this year. Administrative Support Bureau, the Training Academy, really worked very hard to re-envision how we did our judgmental use of force training. And we did some scenario-based training. And Mr. Carroll, I think you probably participated in that this year. Really good stuff. We actually have instituted that in our Citizens Police Academy. So I think a couple of you who were on the board who went through the Citizens Police Academy also experienced it. High stress, high strain, think on your feet. It improves your judgment, it improves your confidence in your abilities, and it really gives you an opportunity to look back on your performance and hone your skills. So I'm very proud of the work that our folks did in that. We reconstructed and improved our Law-Fit obstacle course, which is a mandatory departmental physical fitness program that we've instituted, and we continue to. In fact, we've added this. Last December, we added a full-time wellness coordinator within the department as the center point for all things wellness. We are continue to be committed to that. Mm-hmm. We designed our position readiness education program into seminars instead of classes to help with career development. And we completed an exhaustive review of all of our lessons plans to ensure that every course we teach has an ethical component to it. That is so important. People need to understand the ethics associated with everything that we do. And that was important to me, and our staff got that done. So I'm very happy that our training bureau was able to come through there. Our information systems, what can you say about like a 30-day notice of, hey, by the way, 50% of our workforce is going to be working from home. Make it happen, get it done. Our tech people working in conjunction with IST, really throughout the county, really remarkable, but our tech people have done a great job. And so I wanted to highlight their work. And our crime analysts this year were really given free rein to be able to say, look, you tell us the information that's compelling to you. What do you think our commanders need to know in terms of deployment of resources and personnel based on what you're seeing? And they have come up with some really incredible analysis that has driven our operations and really helped us an awful lot. So that program continues to grow and develop, and we're really, really thankful for them. National Center for Missing and Exploited Children and our Investigations Bureau, we became a certified partner agency with NCMEC this year. We are the largest agency in the United States, law enforcement agency in the United States, to attain this certification. We are the 54th agency in the United States that's out of 18,000 police departments, sheriff's departments, law enforcement organizations in the county. The first agency in Virginia, which is unusual because NCMEC is actually headquartered in Virginia, in Northern Virginia. And our ECC became the 7th center in Virginia to attain this certification. So everybody, through call takers that take 911 calls, to me personally, we have all gone through additional training. Our policies have been reviewed by subject matter experts and reflect best practices in dealing with missing, exploited children. So that really, again, our commitment to protect the vulnerable. Special Victims section has been expanded, and we're really focused on things like that we've never been focused on before, like human trafficking, crimes against the elderly as our population ages, domestic violence. That's where a majority of our homicides are domestic violence-related homicides, and internet crimes against children. These are priorities for us, again, protecting the vulnerable, and our Special Victims personnel. They do a remarkable job in that area. Our homicide detectives, at this point, we're looking at and anticipating a 94% clearance rate on homicides in Chesterfield County. And so that's a message. That's a message to everybody who ever might consider committing a homicide in Chesterfield County. You will be caught. We will catch you. It doesn't matter how crafty you try to be. Chesterfield County Police will catch people who commit homicide in our county. We are committed to preserving human life and protecting the vulnerable. Those are two areas, and our people are shining in that area. Partnership with Parabon Nano Lab. So in 1986, we worked a homicide with a torso that was found in a landfill. And we really had very little information about that. We were able to partner with Parabon this past year, where they were able to use DNA from the victim to develop a profile of what that victim likely looked like. And through that profile, we were able to develop a composite, and through that composite, we were able to identify the victim this last year. And that was able to provide closure to a family who didn't know whether their loved one was living or dead. They assumed that she was probably gone, but now they know. And now they can actually have some closure in that. So the Bureau actually also developed some technological upgrades for surveillance, a high-speed analysis of forensics, like for cell phones. As crime becomes more digital, that capacity becomes more important. And so our personnel we actually have developed a lab up in investigations for that purpose. So every bureau provided insights into how they responded to COVID. Obviously, our uniform operations personnel responded to tens of thousands of calls for service. Our uniform operations personnel, they don't have the ability to telecommute. They don't have the ability to have virtual calls for service. They're in the face of the community 24/7, and they're not just responding to calls, they're doing proactive work, they're doing necessary work with deep moral content, and they're working hard, and their sacrifice, I think, and their commitment needs to be recognized, and I'm very proud of them for that. Our Administrative Support Bureau, they made reasonable modifications to ensure the flow of new hires and trainees. were not disrupted during this pandemic. We ran our police academy. Some agencies shut down their academies. We ran our academy. We ran our hiring process, and we actually did quite well and have done quite well in that process. They've been creative, they've been nimble, they've been working on the fly, and they've been effective. Investigations, they adopted new means for collaboration. Again, they remained flexible and they remained effective. And our clearance rates on homicides, I think, is just one very high-profile example of that. And operational support, I just have to give a shout-out directly to Captain Pete Simbel. This is his first year as a captain. He drew the short straw. Somehow, he joined the command staff and became in charge of our emergency management program here in the department, and then 2020 happened. So I don't know whether to blame him or thank him, but I'm going to choose to do the latter and thank him. Pete's a remarkable individual. He's demonstrated great leadership in his position. He has been assisted by Captain Grahowski and Captain Horowitz as the coordinators of our department's COVID response. Those gentlemen have done a remarkable job, and we really have gotten through this year much because of their efforts. We have lost over 200 officers this year to COVID. And if you think about that, that's more police officers than we lost during September 11th. It's a serious issue. Knock on wood, we have not lost an officer in Chesterfield as a result of COVID, and I point to these gentlemen as key factors in that. So they've done a wonderful job. And I will return back to the quote of April. And I will argue that not only is Chesterfield a great organization, but I think that we've turned the corner and we've become an elite organization. And I'm quite proud of the work that our people have done. I'm thankful for the support that you have shown them, Dr. Casey, that you have shown them. This is a team effort. We could not do this without everybody, but our citizens are safer, our community is safer, our people are happier, and it's a testament to everybody working well together. And with that, I'm going to turn the presentation over to my colleague and friend, Kelly Freed, who's going to have a little bit of an update for you on suicide in Chesterfield County. As she's coming down here, I would just like to ask for a moment of silence. This morning, tragically, we had a law enforcement officer from our region take his own life in Chesterfield County. And this is I don't want to use this as a dovetail into discussing suicide, but this is a pervasive issue that I think in the future we really have to tackle as a profession, as a society. Not just law enforcement suicide, but suicides in general. This gentleman who passed away by his own hand, I would consider a line of duty death. There is a strong correlation between the work that we do and the amount of times that law enforcement personnel take their own lives. This is hard work. The stress is cumulative. And as an organization, we have to continue to be mindful of how we can help support our personnel and get them through this. I've reached out to the chief of that organization, and I've shared our condolences and our support. But we must do better as a profession in preventing these things. And that's no criticism to anybody, but just holistically, we must do better. And the support that you have shown, and that I think our administration and department and community have shown go a long way in helping officers carry that burden and stress that they accumulate each day. So with that, I would just like to ask if you would join me in a moment of silence for that officer. All right, thank you.
Thanks so much, Chief Katz. Mr. Chairman, members of the board, Dr. Casey, with the ongoing pandemic, at the very beginning, we were very concerned about how this might impact the mental health of individuals, our citizens, and especially our youth. And then certainly the longer the pandemic goes on, this continues to be a challenge that we want to continue to address. As Chief Katz mentioned, he and I worked together to put a few slides together just to give the bigger picture of Chesterfield County and what we're seeing, and then I'll be able to speak a little more specifically about our services within mental health. And then lastly, definitely want to highlight the collaboration that we have with all of our county departments, as well as some other key stakeholders about the interventions and services that we have available. So looking at this slide, this really represents a 3-year overview of the attempted suicides in Chesterfield County as a whole. And so as you see, the blue bar represents the attempted suicides, the orange, the actual completed suicides, really hovering around 350. There were a little fewer in 2020. But looking at the gray bar, that represents the percentage of the total that affects juveniles, which is really concerning to us. Looking more specifically about those individuals that receive our services. So while there are quite a few attempted suicides and suicides throughout the county, there's only a subset of the individuals that are actually receiving services through mental health support services. According to the numbers, it's usually around, or it looks like it's around 15%. Now, that does not mean that individuals are not seeking services with a private provider, but we would not know that information. I tried to project this slide according to programs and services because I did want to reflect that we typically see the highest amount of attempted suicides in children, also those receiving substance abuse services, and those with serious mental illnesses, among the other programs and services that we provide. I do want to note that even though we did see an uptick in 2020 for those that were receiving our services, it is much less than what we saw back in FY17. And I tried to dig in and find out what was really going on back in FY17, and that was really about the time that we were really seeing the opioid crisis begin. And we did not have good data back then as far as being able to distinguish when we received overdose information. Was that intentional or was that unintentional as a result of maybe opioids? And so our data is very much reflected now. We know specifically what is a true overdose versus that is unintentional due to substance use. The graph here only represents attempted suicides because one positive about this is that we do not have a lot of completed suicides for those that have received our services. So there's only been 7 through the last 5 years. There have been none in this year, FY20 or FY. For the past 2 years, we have not had a single completed suicide of those receiving our services. We had 4 in FY19, maybe 2 in FY18, and 1 in FY17. So fortunately, we see much more attempted suicides than we do completed suicides. Along the same line, sometimes situations can really result in attempted suicides or suicides can be very challenging. Fortunately, and that sometimes results in the police having to use some of their specialty units. Fortunately, those are few in number, and so they've been collecting data since about 2018, and as this chart shows, 2019 had 3 of these types of situations and then 5 in 2020. It is important to note that we do have 2 mental health clinicians that are specially trained to assist the police. Certainly the police are in charge of these situations because of the safety that is involved, but we do have 2 specially trained folks, mental health clinicians, that assist in these situations from the mental health perspective as needed. So I'm not going to go over all of these for time's sake, but this just shows all of the different ways that we collaborate with both the police and the schools, as well as other partners. Our prevention program has a number of evidence-based prevention programming that they do on an ongoing basis, not only with the schools, but also the general public. As Chief Katz mentioned, in the programming that they have done with the schools and having to switch to virtual means, we did the same thing with our programs so that anything that we were providing in person before, we translated so that we could still provide that in the virtual world. But I just want to highlight a couple of things that we have done as a result of just suicides and attempted suicides in general since the pandemic. So mental health first aid and the applied suicide assistance skills trainings, both of those are offered through the county, through the Learning and Performance Center, as well as through the mental health staff to the general public. But the mental health first aid classes that are designed both for youth and adults, for training adults how to respond to mental health emergencies, those are being held monthly, January through June at this point in time. We also are partnering with the Youth Citizens Board and Communications and Media to develop and implement a campaign towards youth about the importance of recognizing and getting help for mental health concerns. Also, we're partnering with Chesterfield County Schools to develop a video for students on mental health wellness, and this will include an accompanying teacher discussion guide as well as a video for parents, and all of those are going to launch at the same time. Those are just some additional programming that we are developing in addition to all of the many programs that we have in coordination with the schools. Also, with the Chesterfield Suicide Awareness and Prevention Coalition, there's a partnership with Chesterfield County Schools to schedule monthly virtual suicide awareness programs for parents and adult community members, and those are occurring right now from January through May. Also, a suicide prevention effort for adults is a curriculum called More Than Sad, and those trainings are taking place also from January and through May of 2021. I will say that we still receive quite a few referrals directly from Chesterfield County Schools, and so through their Chromebook monitoring, which is only about 5% of the calls that we receive, but they also do a number of threat assessments on any students if they're picking up in anything throughout the school day. And so they refer those calls to our crisis teams. On average, we do about 30 assessments a month, or receive 30 referrals a month through Chesterfield County Schools. I always want to point out our crisis hotline is available 24 hours a day, 7 days a week. If anyone is experiencing a crisis, a psychiatric emergency, the direct number to call to reach our crisis staff is 748-6356. That's on our websites. It's in a number of areas, but I did want to mention that because, we're staffed up, we're there, our same-day access is available, so if somebody is calling with a crisis, they're either going to be served right then by a crisis clinician, or depending on the situation, they can receive immediate access through our same-day access services as well. I do want to say, though, that through our crisis line, we probably receive about 1,100 calls a month, but we are on the phone with our police partners at least 4 and 5 times a day. There is just the best collaboration and partnership that we have to address these issues. So we could not have stronger support in our community with each other and how we work and partner together to address these situations. Chief Katz also mentioned, our concern about the rise in overdoses in general and an increase in substance use. And so I mentioned when I presented to you all earlier in the fall, Lauren Heschler, our opioid outreach coordinator, who is we're fortunate to receive as part of the county's substance abuse steering committee, continues to do wonderful work in our community, and so we are continuing to address that as we continue to do with our attempted suicides. I do want to mention, though, what we are seeing in youth, just as I close, is that from the clinician standpoint, we are seeing much more depression and anxiety in youth. They are very aware, and the clinicians are reporting that the economy, the social isolation, the socio-political events that are occurring, our youth are very, very aware of those situations, and as the clinicians are working with them, they are reporting that very much is impacting, their mental health. And so the FAP team, the Family Assistance Planning Team, which is the effort coordinated with many county departments, there was a time when our mental health clinicians might have a caseload of 10 when they would attend these meetings, and now they have caseloads of close to 60. When they attend these meetings. So we are truly seeing this affecting our youth. We haven't seen a large increase of new individuals requesting to receive our services, but I can say of the individuals, the caseloads of the ones, individuals that we see, they are much more severe and requiring a lot more resources from us than maybe they were a year ago. And as a result of that, we are developing a new group aside from our outpatient counseling, which is called Tolerating Uncertainty. It's going to have a lot of interventions and techniques where we can work with youth. But because of all of the constant uncertainty, we certainly see this as something that's needed. So, in closing, I will just say I can't say enough about our team, our staff at Mental Health and all the work they're doing, but certainly Chief Katz, his team, SAFE, there's just so many partners that we work with, Chesterfield County Schools. We're all trying to tackle it, but it is definitely a continued concern and something that we continue to watch. So, any questions?
Excellent. Board members, any questions?
Mr. Chairman,
Yes.
I just want to say, first of all, thank you to the chief and all of your staff. And I know that every one of us, every time we have an opportunity, stop and say thanks. But Kelly, your folks are kind of the unrecognized warriors behind the scenes. I mean, so many times, I've said this from day one, you folks haven't missed a beat. They keep talking about our first responders, and our first responders are out there, but you folks are right aligned with them because they can't do this. This partnership is so important. Every day you're meeting the needs of our citizens. Here's the interesting thing. We never hear a complaint from either involved in this partnership. Nobody's complaining about having to go to work, serving our citizens. You're boots on the ground, keeping the data and the information here. It's true. We all see this. The escalation of mental health, when these parents are crying to us, they're saying, how can we help our kids? How do we help our kids? But you folks are providing those direct line services. And, honestly, we can't say thank you enough. And I think that it's one of the most minimal things we can do. But, I want, to the extent that we can, spread this message loud and clear. This board supports everything every single one of your folks are doing every single day. Thank you, because you're making a huge difference. As Mr. Holland, I'm going to steal his thunder on the excellence piece, but this is excellence in service. It really is. It's our most vulnerable populations every day is what you're dealing with. And so then the follow-up to that is, as the chief pointed out, the sad news of today. You folks, all of your folks are vulnerable personally, too. They have their own personal vulnerabilities because of the population they're serving. And the 24/7, you look at this, it doesn't stop. It doesn't have a watch attached to it that it's 5 o'clock. And so to the extent that you can come up with any ideas of things that are missing that we need to help supply to those folks, to all of your folks, please let us know. Whether it be the simplest things, and I know all of us take every opportunity we can to say thank you. But, if there are other opportunities too that we can provide some assistance, whatever that may be, to thank these folks, because I know that each and every one of them and their families are vulnerable every day because they are frontline, involved in some really pretty significantly emotional and mental issues themselves. And so they put themselves out there. So I just want people to be very aware of that, we cannot ignore how important that is. It's the people behind the scenes, all the statistics you put out there, but all the people behind the scenes.
Well, thank you so much.
Mr. Winslow.
Just want to echo that and say thank you. Thank you truly. We have safety and we have wellness, and we just have excellence in both. And I so appreciate not only the diligence, but also the focus on character and ethics and how we interact and build relationships on a daily basis. And I see that throughout your mental health, and I see that throughout our police as well as our fire and EMS and sheriff's office. We have truly something special here.
Well said. Other comments? Any other comments?
I just want to go back to the very beginning of your presentation and thank you for offering to cover the fees for the last two animals in the shelter if they were adopted before Christmas. And I don't know if you ended up having to do that or not, but obviously we were successful in clearing out the shelter. And that again, with everything y'all have presented, just shows how we go above and beyond in everything that your teams do together, so thank you.
Ms. Kerr.
I think one other component that the chief didn't touch base on is the, number one, the employee assistance program, which is an important tool to help our officers and other employees throughout the county with issues as they come up. And also the police peer support program, which has been in place for a long time, which is a program I think that, and I was a peer supporter for a long time, that really helps our employees to support one another and then through these difficult times so that they can help manage the stress better. So, and that's just another reason, just another one of those things that our agency has that not all agencies have across the Commonwealth or the country for that matter. And it's an important tool in the toolbox. So thank you.
Thank you so very much. We appreciate you both being here, Ms. Freed, of course, Colonel. You do a tremendous job, outstanding report today, and we're so pleased if there's anything else we can provide to supplement, such as counseling or what have you, please let us know. We're here to serve you because you serve our citizens in this county so very well. We are honored to work with you. Thank you so much.
Thanks so much.